you focusing solely on bone density? Here's why bone quality and microarchitecture can change your perspective on osteoporosis as a whole, as well as its diagnosis and treatment. My name's Dr. Tom Forfa. I reversed my osteoporosis naturally without drugs using my medical knowledge. This channel is for men with osteoporosis who want to reverse it naturally too. Subscribe to get our latest videos. So DEXA scans are important and are used to diagnose osteoporosis, but they miss important details. Multiple research studies highlight the critical role of bone quality and microarchitecture. This refers to the structural integrity and material composition of bones, which are crucial for bone strength and resistance to fractures. This is so important that poor bone quality increases fracture risk independent of bone density. So let me break that down even further. Two people with the same bone density, if one of them has poorer bone quality, they are more likely to break something. Now, bone quality includes things like bone turnover, mineralization, microarchitecture, and collagen integrity. Microarchitecture specifically involves the arrangement and connectivity of trabecular or the spongy bone and cortical hard bone thickness. A great study that I have linked down below highlights that bone mineralization, hydroxyapatite, crystal size, collagen properties, and osteocyte density are key determinants of bone strength and fragility, contributing to the bone's resilience to stress. Even with normal bone density, poor bone quality can increase fracture risk. The problem is that most of us only get DEXA scans done. And DEXA scans primarily measure bone density, so how much bone there is. It doesn't look at bone quality and microarchitecture directly. So a DEXA scan gives you a T-score, and this compares your bone density to that of a healthy young adult. And a T-score of -2.5 or lower indicates osteoporosis. However, men with normal or mildly reduced T-scores might still have fractures if their bone quality and microarchitecture are poor. And this underscores the importance of considering both bone density and bone quality in assessing fracture risk. And so when it comes to actually just looking at your own bone quality, here are the latest advanced diagnostic tools that go beyond standard bone density tests to determine your bone quality and microarchitecture. All right, so the first one, it's a bit of a mouthful. It's called high resolution peripheral quantitative computer tomography, or HRPQCT for short, which is still pretty long. But essentially, this imaging technique provides detailed three-dimensional images of bone microarchitecture at a high resolution, allowing for precise evaluation of trabecular and cortical structures. Then we've got trabecular bone score, or TBS. This is more known, and it's an index derived from DEXA scan images that assesses trabecular microarchitecture indirectly. A low TBS indicates poor bone quality and higher fracture risk. Then we've got magnetic resonance imaging, or MRI for short. We've all heard of that. But advanced MRI techniques can assess bone quality by visualizing bone marrow composition and microstructural integrity. Then we've got one of the most exciting and most talked about methods. The long name is radiofrequency echographic multispectrometry, or REMS for short, REMS. And REMS is a novel ultrasound technique that evaluates bone density and quality. It uses radio frequency signals to assess bone microarchitecture and strength, providing a non-invasive and radiation-free alternative to traditional imaging methods. This method is particularly useful for individuals who can't get DEXA scans or who don't want to, but want a more comprehensive bone quality assessment, bone health assessment. Then we've got medications, right? This is really interesting because medications like bisphosphonates increase bone density, But what about bone quality? So here are the true effects of common osteoporosis medications. So bisphosphonates, for example, they work by inhibiting bone resorption, leading to increased bone density. However, their impact on bone quality and microarchitecture is less pronounced. While bisphosphonates can reduce fracture risk by increasing bone density and reducing bone turnover, they don't have a significant improvement on the intrinsic material properties or microarchitecture of bone. Here's how to actually improve your bone quality. So in most people, it has to be a multifaceted approach that includes the following three things, and there's a fourth bonus I'll talk about as well. Firstly, nutrition. You need to make sure that you're fueling the bone growth sufficiently with the appropriate intake of calcium, vitamin D, magnesium, vitamin K2, as well as the right kind of proteins and enough protein to be able to build the muscle and the bone directly and indirectly. Secondly, we've got triggering the bone growth and development of the right quality with exercise. And engaging in weight bearing and resistance exercise has been shown to be the most effective way of doing that. Walking is not as effective, but things like weightlifting and exercising against resistance helps to stimulate bone formation and improve bone quality and strength. And then thirdly, we've got lifestyle changes like avoiding smoking and excessive alcohol consumption, as well as reducing stress and maintaining a healthy lifestyle along the way. Then the fourth bonus is the medications, right? They do help strengthen bones, and in fact, some of them do have an effect on bone quality. So in addition to bisphosphonates, other medications like tirapatide and denosumab can improve bone density and quality to an extent. Particularly, tirapatide stimulates new bone formation and improves microarchitecture. But consult your healthcare provider to determine the best medication and treatment in your condition. But for now, subscribe to receive more videos about men's osteoporosis.